A very good evening. From stories around the world to stories here at home, this is the National News Broadcast. I'm Vidushni Satish Kumar.
Good evening, I'm Stefan Delvis. Let's take a look at the main headlines for tonight.
The Sri Lanka Navy confirms of no oil spill from the New Diamond vessel. The President commends all units involved in the New Diamond firefighting operation. The President says that the requirement of maintaining a centralized health service was made prominent by the COVID-19 pandemic. 9 individuals arrested in connection with the theft of turmeric from the customs container terminal at Grand Pass. Allegations leveled at President Trump for insulting US armed forces.
Now in your local stories in detail. The Sri Lanka Navy states that no oil spill has occurred from the New Diamond fuel tanker, which reported of a fire when sailing in the eastern seas of Sri Lanka. The vessel has been tugged to an exclusive economic territory 40 nautical miles away and the blaze has been controlled. A continuous operation is underway to contain the blaze with the assistance of the Sri Lankan Navy, Air Force, Indian Coast Guard and 2 tugboats of the Mahabodhya port. A team of Indian Coast Guard personnel entered the New Diamond after the blaze was controlled to a certain extent by last evening. The vessel was tugged towards a deep sea area 40 nautical miles away from the shore with the assistance of 11 vessels and the tugboats. The tugboats Ravana and Vasamba and the vessels Sayura, Sindurala, Ranarisi, Samudra Araksha and Sam Araksha were deployed in the operation. The relevant chemicals and equipment required to douse the blaze are being supplied by several vessels. The tugboats are continuously spraying water to cool the body of the ship where the fire ignited. In addition, the Air Force states that 2,500 liters of water was sprayed since this morning, deploying an Mi-17 type helicopter, an observational aircraft of the Beechcraft type and a Y-12 type aircraft has also been deployed in the operation. The Navy states that the vessel is fully secure and no oil spill has been reported due to the fire.
The present status of the distressed vessel New Diamond. Presently, the ship 40 nautical miles away from the Sri Lankan coast. To be exact, it's 40 nautical miles east of Sangaman Kanda Tuduwa. At the initial stage, ship caught up with fire. It was 38 nautical miles from the Sangaman Kanda point. Then ship lost her power and it was made to drift. And due to the existing current in the area, ship was drifted towards the Sri Lankan southeastern coast. Since it was posing a threat to both the environment and the ship, we decided 20 nautical miles from the land, we should pull the ship out of the out to the safer area. Now the ship lies 40 nautical miles east of Sangaman Kanda point. Also, there are 11 ships currently actively engaged the fight in this fire, and there are 2 Sri Lankan Coast Guard ships and 3 Sri Lankan fast attack crafts supplying the chemicals from Colombo, Hambantota and Trincomalee to the scene. Now they are being distributed among the ships that are engaged in firefighting, and situation fire is taken under control, but it's not over yet. It will take some time to completely extinguish the fire.
A Dornier-type aircraft has been deployed in the operation by the Indian Coast Guard and the required supplies are being facilitated from the Mattala International Airport. The Indian Coast Guard in a tweet on its Twitter account states that no risk of an oil spill is prevalent. The vessel, which reported of the blaze on the morning of the 3rd of this month, was en route to India carrying over 270,000 metric tons of crude oil. New Diamond is a fuel tanker registered with the government of Panama. The Marine Environment Authority states that the Director General of the Department of Merchant Shipping, the proprietor of the New Diamond vessel and its agent based in Sri Lanka and the respective insurance company are conducting discussions on the future measures to be taken, which include tugging the vessel away into another maritime zone and transferring the fuel to another vessel.
Then our next task is to how to deal with the disease ship with this amount of oil. So for that, Department of Merchant Shipping, Director General, and at the same time the owner of the ship and the Sri Lankan agent of insurance company, and they will look after the fate of cargo and the ship. Those discussions are still ongoing. So at the same time, we receive support from Indian Coast Guard and Indian naval vessels and Sri Lanka naval vessels and Sri Lanka Coast Guard and Air Force.
When the blaze occurred, the vessel was sailing within the maritime zone of Sri Lanka. However, currently it is positioned around 40 nautical miles away from the island to an exclusive economic territory. Since both these maritime zones are part of Sri Lankan waters, the Marine Environment Authority is alert on the environmental damage caused by the disaster. Meanwhile, President Gotabaya Rajapaksa, in a tweet on his Twitter account, expressed his thanks to the personnel of all forces who are engaged in the firefighting operation of the MT New Diamond vessel. The President especially expressed appreciation towards the Sri Lankan Navy, the Sri Lanka Air Force, the Sri Lanka Ports Authority and the Indian Coast Guard, stating that he commends the efforts taken by them to conserve oceanic biological resources.
President Gotabaya Rajapaksa says that the significant requirement of maintaining a centralized health service is the most important lesson that the COVID-19 epidemic teaches the country. The President made this comment joining a two-day workshop at the Manelvatta Nagananda International Buddhist Studies Institution at Bollagala in Kelaniya today. The workshop, organised by the Government Medical Officers Association, includes the participation of 680 apprentice doctors selected for internship. Over 100 professors and specialists are scheduled to conduct presentations at the workshop. President Gotabaya Rajapaksa, delivering the keynote address, stated that although many hospitals are administered by provincial councils, an adequate number of hospitals are managed by the Health Ministry, enabling their swift deployment in a health crisis situation. The President pointed out that if the health service was fully entrusted to the administration of the provincial councils, the efficiency of Sri Lanka's response to the COVID-19 epidemic would have been vastly different. The President stated that the time has come for public health services to proceed along an innovative approach.
Moving forward, it is important for us as a nation to truly understand the challenges and opportunities that face us and to design our response to them appropriately. The mandate given to the government by the people at the parliamentary election just a month ago makes it very clear that the Sri Lankan public is hungry for development and tired of excuses. One of the core pillars of development is the maintenance of a healthy population. Achieving certain public health goals remains a core responsibility of the government. I am determined to work towards creating a healthy nation during my tenure as President of this country. My recent visit to every corner of Sri Lanka exposed me in depth to many real issues that our fellow citizens face. These grassroots level issues are wide-ranging, from lack of drinking water to lack of education to lack of proper healthcare facilities. There are many rural areas of the country where people have to travel long distance in order to consult with doctors for their various ailments. Unfortunately, the population density in these areas could be too low to justify the building of hospitals or other healthcare infrastructure that can adequately cater to the needs of these people, particularly considering Sri Lanka's present economic position. However, there may be simpler solutions to these problems that can be adopted with a more proactive, practical mindset. One of the more successful healthcare initiatives in the history of Sri Lanka, and another that has been commended internationally, is the public health midwife program. These hard-working healthcare service providers have delivered community-level maternal and child healthcare throughout Sri Lanka for decades. They have been the frontline health workers, delivering care and advice to women and children at the household level in many rural communities. Similarly, it may now be opportune for us to introduce a new concept, that of the public health nurse, who could provide basic health care services to those in very rural communities that lack access to other health care infrastructure. Adequately trained and qualified nurses may be able to help diagnose and treat simple ailments, and given individuals requiring higher level care, the advice required to seek medical attention. They could perhaps even refer patients to doctors in the region as and when required. This sort of initiative may contribute significantly to improving access to health care within rural communities and thereby contribute towards better health care in the nation at large. So I take this opportunity to pay tribute to and express my gratitude to all healthcare professionals and others who contributed to Sri Lanka's response to COVID-19 pandemic. The outstanding success Sri Lanka achieved in this endeavor came at a time when even some of the most developed countries in the world were unable to respond adequately to the pandemic. Due to a variety of factors ranging from a delayed response by the government to the lack of universal health insurance, the unpreparedness of their healthcare institutions, the lack of sufficient testing, to the inadequacy of their management systems, the spread of the virus could not be contained in several developed nations. In many countries, patients who were infected with this virus were turned away from hospitals and left to fend for themselves or were not treated with adequate care. This resulted in community transmission of the disease, ultimately resulting in soaring rate of infection and death in these countries. In this context, while I express my profound sympathy for the plight of those nations who have borne the brunt of the COVID-19 pandemic, I'm also proud to say Sri Lanka, despite still being a developing country, managed to face this situation very successfully because of our free healthcare system. Not even a single patient suspected to being infected with COVID-19 was turned away from our healthcare system. Each and every patient was treated at our government hospitals at government's expense, and 10 confirmed cases have been successfully cured to date, with only 12 fatalities thus far. The preparedness of our public health infrastructure, hard work of our public health inspectors, combined with other arms of the government, including the police, intelligence services and armed forces, ensured that proper contact tracing and isolation took place, thereby preventing community transmission of the virus in Sri Lanka. The robust testing mechanism we were able to set up in a short time supported this effort by identifying asymptomatic patients and ensuring their isolation and proper care. We have also repatriated thousands of our citizens from countries where the virus is spreading. To be precise, as of today, 31,664 from 105 countries were repatriated, and returnees also have been housed at quarantine centers around the island, where they are looked after to a very high standard by our armed forces personnel. Most of these centers are managed entirely at the expense of the government. These are all remarkable achievements by any yardstick. These achievements are why Sri Lanka's success in dealing with the COVID-19 pandemic has been justly commended by international institutions, including the World Health Organization and UNICEF, as well as many foreign nations, international commentators and individuals. The effectiveness of Sri Lanka management of the COVID-19 pandemic signifies the strength of our public healthcare system.
The event was also attended by Secretary to the Ministry of Health, retired Major General Dr. Sanjeev Munasinghe, and President of the Government Medical Officers Association, Consultant Dr. Anurapura. President Rajapaksa, who attended the event as the chief guest, met with CEO of the Nagananda International Buddhist Institution, chief incumbent of the Manilvatta Viharya, Venerable Dr. Bodhagama Chandimathera, and engaged in a cordial discussion. The chief prelate presented the president with a souvenir depicting the historic Jai Shri Mahabodhya at Anurapura. Prime Minister Mahinda Rajapaksa visited the Katharagama sacred site and engaged in many religious rites conducted last night and this afternoon. The Premier first called on chief incumbent of the Kiribihera Rajamahaviharya, Venerable Kobawaka Dhamminda Thera, and engaged in a cordial discussion. Thereafter, upon arriving at the Katharagama sacred site, Premier Mahinda Rajapaksa paid homage to the Ashtapala Bodhya, at which an all-night Pirit chanting and Dhamma sermon was conducted to invoke blessings on the Prime Minister and the country. These religious activities were organized upon the guidance of Chief Adhikarana Sanganayaka of Ruhunu Magampattuwa, Venerable Kapugama Sarantissa Thera. Prime Minister Mahinda Rajapaksa also joined in a Deva Puja at the Katharagama Devalaya. He engaged in a cordial discussion with the devotees present. The Premier was accompanied by State Minister Lohan Ratwatta, Chairman of the Katharagama Pradeshya Sabha Chanaka Amila Rangana, and Basnayaka Nilame of the Katharagama Devalaya Dilruwan Rajapaksa. The police constable attached to the Colombo Crimes Division, who is suspected to have concealed the whole of 23 kilograms of heroin recently seized by the Meghalaya police, has been arrested by the Indian police in the South Indian area of Dhanushkodi. The brother of this police constable in question had reportedly been arrested with the seized heroin. The whole of heroin was found hidden in a carpentry shed. Meanwhile, 9 individuals have been arrested in connection with a theft of 18,180 kilograms of turmeric from a container terminal maintained by the Sri Lanka Customs at Grand Pass in Colombo. The police headquarters states that over 45 million rupees earned by the suspects have been uncovered. The police headquarters states that the theft was reported on the 28th of August by a group that made an unauthorized entry into the container terminal and carried out the robbery by breaking the customs seal of a container prepared for transshipment. The stock of turmeric had been imported by a private sector institution in Petta. As the importation had taken place when a ban is in place, the container was retained for re-exportation at the Sri Lanka Customs, which is when the theft occurred. The CID arrested the first suspect on the 29th of August and thereafter arrested another 3, whilst another 5 suspects were arrested on the 31st of August. In addition, 2 vans and a lorry deployed in the robbery, 20 kilos of turmeric, over 12 kilos of turmeric powder and a new motor car purchased with the monies earned was seized by the police. The 9 suspects were produced before the Colombo Magistrates Court yesterday and were remanded until the 18th of this month. Five individuals were arrested at dawn today in the Panaduru area with around 500 grams of heroin in possession. The police state that information has revealed that the smuggling racket has been operated by a prison inmate. Smuggling has reportedly taken place by hiding narcotics at various secret locations, including amongst lampposts. A close associate of organised criminal Dinuka Madushan alias Keselwata Dinuka, who has fled overseas, has been arrested yesterday with heroin, swords and several motorcycles in possession. The police special task force, upon a tip-off received by the intelligence unit, carried out a raid in the Enderamulla area at Wattala. The arrestee is a resident of Uswata Keyyava, aged 23. The police special task force seized over 5 grams of heroin, 3 swords, 3 motorcycles and a lorry. Over 183 million rupees suspected to have been earned through drug smuggling have reportedly transacted through several bank accounts of the suspect.
The Lankan-born aerospace engineer working at NASA's prestigious Jet Propulsion Laboratory, Melanie Mahabodhya, is part of the design team working on the Mars 2020 rover, which will attempt to find signs of past life on the red planet when it ventures into space. Today she spoke to Rupavahini to share her experience with Sri Lankans. The Perseverance rover was to be launched from Cape Canaveral Air Force Station in Florida, July 30th, and is scheduled to land in the Jezero crater on Mars in February 2021, with a mission duration of about 687 Earth days. Melanie was a lead engineer of the Mars rover 2020 mission at the NASA Jet Propulsion Laboratory in Pasadena, California. She moved with her family to the United States from Sri Lanka, building a career in aerospace after graduating from UCLA with a degree in mechanical engineering, and has since worked at SpaceX, Boeing and NASA. Melanie says NASA's Mars program has never attempted to design a fully digital mock-up of any electrical subsystem before because of its complexity. Speaking to Rupavahini, she said that she was leading the internal cabling design and communication system with a team of 6 to help them achieve this feat.
I was the lead engineer for electrical and telecommunication cable system, and my team with hundreds of other engineers and scientists worked really hard for the last 6-7 years to get this Mars rover launching. Let's back up one mission earlier. 2012, we landed the very first car-sized rover. Cost a lot of money, and the mission of that rover was to go and find resources that we need to actually live. So like simple like air and water. This is the very first Mars mission or any space mission that is going to bring rock samples and Mars samples back to Earth. So our 2025 mission is going to bring back those samples, but this mission is going to collect those important samples and just like embed them in Mars. So this mission is very, very flagship mission for our Mars missions, and I'm very proud to be part of it.
Well, we now bring you the special segment, Red Light. The area you see now is the Tittavalla village in Kurunegala. The main source of livelihood in this area relies on the pottery industry. Although a common amenities center was declared open previously, it does not cater to the needs of the industry as the machinery has been out of order for several years. How unfortunate is it for officials to remain inactive when the necessity of deploying technology to upgrade traditional industries is evident? This is for the attention of the State Minister of Rural Industries and the promotion of industries relating to cane, brassware, clay and furniture.
Minister Chamal Rajapaksa engaged in an observational visit at the Boralla police station today. The proposed plot of land for the construction of the new police station was also inspected by the Minister, Acting IGP CD Vikramaratne and Senior DIG Deshabandhu Tenukun also accompanied the Minister. The newly constructed emergency treatment unit of the Dambulla Hospital was vested with the public by Minister Janaka Bandara Tennakun today. The cost involved has been 10 million rupees. Parliamentarian Premitha Bandara Tennakun and a group of invitees were present.
Well, in another 3 months, the residents of Lanka will benefit from a newly carpeted road. However, we at Rupavahini journeyed to Lanka along the existing old road. Recently, this is a segment of the lives of the Lanka residents. The village of Lanka can be described as a remote but beautiful village in Sri Lanka. The history of this village dates back to the times of King Valagamba. The main livelihood of the villagers is based on the tea and kettle industry. The Lanka village, which borders the Singharaja Forest Reserve, was a topic of conservation recently, with steps taken by the government to carpet the dilapidated road leading to the village. Environmentalists alleged that the road reconstruction causes harm to the Singharaja Forest Reserve. However, traditional residents of the area reject the claim. Journeying along the old road, it takes over 4 hours for the residents of Lanka to reach the Nelluwa or Deniaya towns. Over 700 families reside on either side of this road. The only school available in this area is the Lanka Junior School, at which around 200 students study. Even amidst difficulties, students of the Lanka Junior School have excelled in sports and studies in the Udugama educational zone. Since the residents of the area have faced difficulties over the years, the reconstruction of the roadway is a relief to them. Recently, President Gotabaya Rajapaksa visited the village to witness the reconstruction work and instructed the relevant officials to upgrade the road within 90 days with no damage to the Singharaja Forest Reserve. The roadway extends up to 80 kilometers and is 12 feet wide. Reconstruction work is being carried out by the Army under the supervision of the Road Development Authority. Once this roadway is completed, the journey from Lanka to Nelluwa or Deniaya will take just 45 minutes. Welcome back. Now in your sports news. Minister Nama Rajapaksa states that at present a shortage of sports trainers is observed across all sporting fields. As a solution, a special program was launched at the Ministry of Sports yesterday to instruct on sports over the internet. Minister Nama Rajapaksa stated that a special program has been organized to release over YouTube tutorials necessary for sports training, collecting together the inputs of national-level trainers and sportspersons. He further stated that sports clubs have been educated on compiling online tutorials of a few minutes duration with the assistance of national-level trainers and sportspersons attached to their clubs. Minister Nama Rajapaksa stated that he believes that the state sector and the private sector need to join together to uplift sports and thereby uplift the youth. He stated that this program has also been a public-private joint endeavor. The Minister of Sports further stated that this opportunity will be created for online coaching to be made available from international level trainers as well.
ජාත්‍යන්තර තලයේ පුහුණුකරුවන් සහ ජාතික කණ්ඩායමේ පුහුණුකරුවාගේ උපදෙස් මේ අන්තර්ජාලය හරහා ලබා ගන්න පුළුවන් හැකියාව අපි නිර්මාණය කරනවා.
Minister Nama Rajapaksa also stated that steps will be taken to network 25 national schools in the country with the Ministry of Sports. The launching event was attended by representatives of sports clubs.
That's it for the news this evening. Have a good night.
Good night.